So today, I'm going to be talking to you all about Western versus alternative medicine and injury prevention and sport rehabilitation. Conventional therapy, or Western medicine, is what we see throughout the medical field in the United States today, and definitely the most common in the U.S. This type of medicine includes nurses, doctors, surgeons, x-ray technicians, pharmacists, therapists, and more, all working together to treat patients. For example, when someone breaks a bone, they see a physician who follows the same general protocol every time, determines if the bone is broken, order an x-ray to confirm, determine if surgery is necessary, and begin the healing process. This is a great example of Western medicine. Typically will include all three components of drugs, radiation, and surgery. According to Caring Ambassadors, Western medicine is evidence-based. Physicians use research and statistics to provide the best option for their patients. Clinical trials are a large part of how health care professionals are able to make the advancements they have. By having some volunteers test our various treatment options, they are able to find the most effective ways to treat a lot of things. All treatments have been studied very carefully, and all of the possible negative outcomes are known to both the health care professionals and the patient prior to the procedure or administration of medicine. While there still is a lot of risk associated with this type of medicine, there is so much research that supports conventional treatments, which can give patients a lot of comfort and peace of mind knowing what the results will be. Along with this, Western medicine provides fast results in diagnosis, thus allowing athletes to have a faster recovery. Opposed to alternative medicine, Western medicine diagnoses the specific point of injury and fixes it on the spot. Once injured, athletes can go to the hospital and see a physician who will perform tests, have x-rays done, have a clear understanding of the problem, and a plan for recovery within a few hours. Recovery may include surgery, which means a long and difficult recovery, but athletes should return to the same or higher level of play than ever before. Typically, after a surgery, patients are brought to a recovery room. Once in the recovery room, patients will be closely monitored anywhere from 45 minutes to 2 hours. After this, they may have longer, depending on the surgery, depending on their reaction to anesthesia and what type of surgery they had. While conventional treatments are generally quick and accurate, there are a few problems with the use of conventional therapy. The main problem is that certain conventional treatments will treat the pain, but not the underlying issue causing the pain. For example, anti-inflammatory medication is widely used in athletics for pain management. The problem with this is consistently taking anti-inflammatories is not addressing or fixing the actual problem, which is whatever causing the inflammation. Anti-inflammatories and pain medication could lead to major health problems over a long period of time. If not careful, pain medication could easily lead to addiction. The pills help with the pain, and many people love the way they make you feel. If you take anti-inflammatories, you have an extended period of time, it could potentially cause kidney failures. The substance must be broken down and processed through the kidneys for its effects, which puts extra strain on the organ. Alternative medicine are any unconventional therapies as medical interventions not taught in U.S. medical schools are generally available at U.S. hospitals, including acupuncture, chiropractic, and massage therapy. This type of medicine includes mind-body interventions, manipulating and body-based methods, energy therapies, and diet. These types of treatments have been used to help a wide variety of problems, including cancer, arthritis, back pain, gastrointestinal problems, eating disorders, and immunodeficiency disorders. Alternative medicine has a long history and has been observed in other cultures since the beginning of man. But it was fairly recently that Western medicine became available and accessible in places where conventional medicine is prominent. Alternative medicine has been around since ancient times. They were used as home remedies and made when other forms of healthcare were not available. With this advancement of Western medicine and technology, alternative forms of medicine were basically lost in the United States. People lost the belief in natural remedies and the body healing itself. According to Torian from the University of Oregon, time and time again, alternative forms of medicine were frowned upon and discouraged people because of the lack of medical research. It was not until the 1990s and the early 2000s that alternative medicine received enough evidence to become a valid form of treatment. Torian provides a general lifetime with a history of CAM in the United States beginning in 1970 and ending in 2011. Significant events include a $2 million budget being set for CAM research in 1992, Congress increasing the budget to $48.9 million in 1998, and 22 colleges joining CAH-CIM, which incorporated CAM into a medical school in 2003. Alternative medicine may be a longer fix. However, these forms of treatments are still commonly used to treat acute injuries, especially in sports. Alternative medicines can do more than rehab injuries. It can also loosen up those tight muscles to prevent potential injuries. Cupping, acupuncture, stem, and many other forms of treatment are commonly used in the training rooms across the world for their athletes. They may take a little longer to fix the problem, but the athletes can also continue to play while getting the treatment necessary. Mind and body practices, including acupuncture, meditation, and yoga, have been shown to improve all performances in athletes. This is why we see such strong similarities between the modern-day sport mentality and ancient spiritual practices such as yoga and Tai Chi. Mental aspects that include conscious breathing and being aware of your body are key components of yoga that have been practiced in the Hindu religion since ancient times. The intent of yoga is to enhance bodily awareness and strengthen the mind-body connection, or to practice being mindful. These directly correlate to sports and athletic performance. Being able to be in tune allows athletes to make faster and better decisions and allows athletes to overcome stress, slow reactions, and overthinking. The physical aspects of yoga can also be beneficial for rehabilitation as it is an active form of stretching and engage all muscle groups. Simple things that athletes use for all the time to enhance performance is protein, amino acids, creatine products, or even daily vitamins, including fish oil, ginseng, and glucosamine. These products have become so normalized that at first glance, most people might not even realize these are actual non-conventional methods that aren't always studied or practiced in the United States. This is one example of how unconventional therapies have integrated into the sports culture, and this has greatly influenced science. Today, there is a lot of research regarding herbal medicine and supplements, and many studies have been done to understand them better. As research has developed, taking supplements and changing your diet is safer than ever and can be monitored through one's regular physician as well as nutrition or diet specialist. The most common sports injuries are strains and sprains. These types of injuries happen all the time and are extremely common, but usually aren't too bad. They are usually treatable with a combination of rest, ice, compression, and elevation. These are all examples of unconventional therapies that do not include surgery, radiation, or medication, but are accepted and practiced regularly in the U.S. prior to any of those approaches being taken. Most serious injuries, such as a broken bone, require a much more serious approach, including Western methods. Rest, ice, compression, and elevation can be used to alleviate pain, but these injuries require diagnostic tests and usually some sort of surgery. Once they are injured, athletes have two main forms of treatment to choose from: Western alternative medicine. They need to consider what works for them and how severe the injury is. For example, a torn ligament could potentially need surgery to heal. However, it is a grade 1 or 2 tear. A brace or tape could be used to support the ligament so that the athlete could continue playing. Surgery is not always the answer, but many doctors today want to resort to that instead of thinking of alternative options. but it is really specific to each individual athlete and each individual injury to assess the proper course of treatment. In sports, many injured players will want to return to play as soon as possible. However, the decision between whether to use Western medicine or alternative medicine varies from person to person and case to case. Many different factors could play a role in making the decision. For example, age, sport, amount of time for recovery, and type of injury would influence this decision. According to Magner of Well and Good, it is important to consider all the options and to determine if one approach is better than the other. Also to know when to switch if either approach is not working as expected. There are some decisions an athlete and his or her doctor has when it comes to their care. One example is the use of pain medication, more of a Western approach, versus using various mind-body practices and manipulations to alleviate the pain. Another example is an athlete choosing to use supplements like fish oil and turmeric during recovery. There have been studies that have shown that this is an effective way in helping improve recovery times, although the use of supplements is not a conventional approach. Unless it is a severe injury, athletes often go to the athletic training room for their day-to-day rehab. The methods practiced in the training room are consistent with alternative medicines. This allows the athlete to get treatment without having to completely sit out because of the surgery. However, it is common for athletes to use forms of alternative medicine to deal with the pain so that they can play through. They will undergo their rehab and go until they are not gaining any more progress to getting back to 100%. At this time, they may turn to forms of Western medicine for a new diagnosis and treatment plan. Although Western and alternative medicine are so different, they share a similar goal. They both want to heal the patients, one using research technology and the other using the mind over body. Since alternative medicine is still being brought up in the medical field, more people are starting to put both Western and alternative approaches together to rehabilitate and treat the injuries. Woods of Health Library states that integrating these two types of injuries together would treat patients as a whole person, their minds as well as their physical bodies. For example, people who undergo radiation or surgery would use alternative methods such as meditation or acupuncture to help with the pain, instead of taking drugs that may cause dependency. As a collegiate athlete, I've used both forms of Western and alternative medicines for different kinds of injuries. Two of the biggest injuries I've had to use treatment for are a labrum tear and arthritis. For the arthritis, I took more of a Western medicine approach and had to get all the x-rays and scans and all the other diagnostics needed to determine what it was. And after that, I used medication from the doctor to treat my symptoms. For my labrum, I decided to take the alternative approach and do more of rehab, such as stretching and band work to strengthen the muscles. For both, I took turmeric and fish oil, which is also a form of alternative medicine. To choose between Western or alternative medicine, there is no right or wrong answer. The best way of treating an issue is still an arising topic in the medical field, and there's still no clear answer. This is mainly because everybody is different and every injury has their specific needs. While some people may respond extremely well to the natural treatment, others may see no results depending on their injury, their pain tolerance, and more. When rehabbing or training an injury, alternative medicine may not be the answer, and Western medicine is the only way to fix the problem. Whatever treatment is decided, it is important to understand all treatment options, including both conventional and unconventional methods, before making a decision. There are many pros and cons of each, but using a combination of the two has been proven to be the best. The definite diagnostics that conventional medicine provides are important for injury recovery and athletics, and the mind-body connection, diet, supplement benefits, and manipulative therapies offered through unconventional medicine are very important to improve performance, preventing injury, and recover from the muscle fatigue quicker. As time goes by, both fields of medicines will continue to grow and come up with new developments and research. The sky's the limits for the medical field of rehabilitation. Who knows what new information we will have in the years to come.